Before we can discuss complications or contraindications, it's essential to understand how these two categories of devices differ because their risks and clinical responsibilities are not the same. Radial shockwave devices generate pressure waves, which disperse outward from the applicator and penetrate more superficially. They are ideal for broad, superficial tissues, but their energy is less controlled at depth. Focused shockwave devices deliver true acoustic shockwaves that converge at a specific focal point. This creates much higher peak pressure, deeper penetration, and more precise targeting, making focused ESWT more powerful but also more technically demanding. Understanding the physics behind each device is the foundation of safe practice. In the US, radial devices are typically categorized as Class 1 or 2 ultrasonic, massage, or pressure wave devices, depending on the manufacturer's registration pathway. Focused shockwave is regulated as a Class 2 or 3 medical device under ESWT, meaning it is intended for medical indications and must follow stricter safety and usage standards for good reason. This classification directly affects who is legally permitted to operate each device. Because radial shockwave often falls under wellness or therapeutic categories, it may be used by licensed clinicians, certified medical assistants, allied health professionals, and trained support staff, depending on local state law. Focused shockwave, however, is a medical procedure. Use is typically restricted to licensed medical doctors, physical therapists, chiropractors, and other licensed medical professionals with scope of practice authority, or under the direct supervision of the licensed provider. Always check your state's regulatory board for specific rules on device delegation. According to international standards such as those promoted by professional ESWT organizations, providers should meet basic requirements before performing extracorporeal shockwave therapy. This includes foundational training in anatomy and differential diagnosis, understanding of ESWT indications, contraindications and treatment goals, competency in device operation and parameter selection, ability to identify red flags and refer patients when needed, and documented training for each device a provider uses. These standards ensure providers have the clinical judgment necessary to use shockwave safely and effectively. Radial shockwave carries risks related to overtreatment, bruising, nerve irritation, and treating areas that are too superficial for safe pressure wave dispersion. Focused shockwave has deeper risks, including periosteal pain, nerve sensitivity, vascular irritation, and targeting errors due to its precise focal energy. When misused, its higher energy levels can aggravate existing pathology or impact structures that should not be treated. By understanding the differences between radial and focused shockwave, how they work, how they're regulated, and who is qualified to use them, you build the foundation for safe, competent, and compliant ESWT practice. When you're ready, move on to the next lesson on contraindications and patient safety.